My name is John Bowers. I'm a graduate assistant here at Northern Michigan University. I'm working on my master's in exercise science. I'm going to do a video presentation today on altitude training. Here's my outline. I'm going to start off with a background, give you a little bit of background information on altitude training, how it began, where we got to where we are today with the altitude training theories. I'm also going to look at theories behind altitude training. What drives the physiological process of this? I'll go into all the theories of that. Effects of altitude. So I'm going to look at how oxygen affects the respiratory system and how altitude changes that, increasing that drive in the oxygen cascade. I'm also going to talk about different types of altitude training. So I'll talk about the high, live high, train high technique, and also the high-low techniques, which is the train high, live high, train low techniques. So we kind of got both worlds in there. And then finally, I'm going to bring in some practical applications. So this is going to be your take-home message from this video. Basically, what I want you guys to know about altitude training, how to use it appropriately. So purpose, I want to give an understanding of altitude training and its physiological effects. And then I also want to allow implementation into training programs or give advice on altitude training to athletes. This is kind of designed for coaches, for exercise science majors, possibly athletic trainers who have an interest in altitude training and want to apply it to their training regimen. So some background. Altitude training kind of came around, or the research kind of came for it around 1968. That year, the Olympics were held in Mexico City, which has an altitude of 7,349 feet. And this Olympic kind of really changed the outcome. You see in the results, the Mexicans, Kenyans, and Ethiopians really dominated. And although they're great athletes, it's not what was really expected. So a lot of research started, okay, well, why were they able to do so well, perform so well in this high altitude atmosphere? And a lot of that went back to those three countries all live in high altitudes. So not only were they living in high altitudes, they're training in high altitudes, and this led to improved performance in the Olympics that were held in a high altitude area. So this launched a ton of research into altitude training. Up to this point, really the only research that had been performed was on rock climbing, and that is obviously a little bit different than altitude training compared to endurance events. So the theories behind altitude training. So you got the physiology of high altitude. At high altitude, the partial pressure of oxygen is lower than at sea level, meaning there is less oxygen per volume of air. So basically, you're breathing 21% of oxygen at sea level and at altitude. However, there's less volume, less pressure on the oxygen. So this really cuts back on the amount of oxygen that you're able to absorb into your body. So this lowers the rate of diffusion that depends on that pressure. The second theory I'm going to talk about is the oxygen cascade theory. And this is the driving force from the ambient air to the lungs, blood, and cells. And this driving force is diminished at altitude, thus the rate of diffusion in the oxygen cascade is slowed. So you'll see here, this is the oxygen saturation levels. So I'll talk about this a good amount. You'll see here, this is going to be a right shift, and that's generally when the body requires more oxygen. So that can be due to high temperature. If you're working out, your body's going to require more oxygen for function. So you see here, a right dissociation is going to require more oxygen. A left dissociation is going to require less oxygen. So if you think of lower or cold temperatures, you don't need as much oxygen. And then also lower carbon dioxide levels, you're not going to use as much oxygen as well. Kind of the driving force behind altitude training is EPO. And this is basically when you get to altitude, you have less oxygen in your system, and your kidneys pick that up through the blood. So they send off a little signal to the bone marrow, and this encourages the more reproduction of red blood cells. So not only do you have your normal count of red blood cells, but you get a little bit of boost in that count. And this is really where the altitude training comes into effect. So you see here, kidneys are able to pick up the less oxygen in the blood. So what they do is they send that signal to this, they increase the production of EPO, which is that signal that goes over to the bone marrow. And the bone marrow shoots up the production of red blood cells. And this is the driving force of what athletes want. They want to have more red blood cells in order to perform better in endurance activities. So acclimatization with altitude. So you have adaptive responses in physiology and metabolic processes in the body. And what happens is they'll start off overreacting to the altitude, and eventually they'll adapt to it to the point where you can function properly. When you acclimatize to certain levels, if you go higher, you're going to require more acclimatization as well. So if you're acclimatized at 8,000 feet and you go up to 9,000, you're still going to have an acclimatization period. Elevations higher than 2,300 meters initiates rapid physiological adaptations. So you'll see an increase in respiratory function, so hyperventilation, and you also see an increase in blood flow. And that's going to happen during rest and also maximal exercises. So your heart and your lungs are working harder to get the oxygen to the rest of your body. So cardiovascular responses. So the heart rate initially is going to shoot up. The body needs more oxygen, and the heart rate will increase the oxygen output. And that's going to generally stay increased throughout your stay at altitude. Stroke volume is going to stay the same. That's not going to change at all. Your heart's still working the same way, same efficient process. However, over time that will decrease, and that's mainly due to the hemoglobin response, where you get more hemoglobin in your system. And finally, the cardiac output will increase acutely, and that goes along with the heart rate. Your body needs more oxygen, so they get that out there. And then as you acclimatize with the altitude, that will decrease along with the stroke volume. So ventilatory response. So initially you'll have hyperventilation, and that's due to trying to get as much oxygen as you can into your lungs and into your system. So what happens is you initially respond to the high altitude by excess breathing. You absorb that. You try to encourage oxygen cascade, even though it is harder in altitude. This force is driven by the hypoxic nature of altitude, and this is going to increase alveolar PO2, and then it'll give you a left shift of the oxyhemoglobin dissociation curve, which we talked about earlier. So some post-altitude effects. So these are what you're going to see possibly after altitude exposure, or you become acclimatized. So your blood lactate will decrease initially, and that can steady as you go along. You'll see an increase in hemoglobin, and like I said before, that's the desired response. You want to get that increase in hemoglobin, increase in oxygen carrying rate, and possibly increase in endurance. Red blood cell mass, you'll get increase in that, and that's once again a desired effect. You also get an increase in hematocrit. So some more post-altitude effects. So as your respiratory system becomes acclimatized, that can stay elevated for several weeks following, and that has actually been measured to stay elevated for a year, up to a year longer. But that generally depends on the person, if they're a responder or a non-responder. VO2 max may increase or stay the same, and that depends severely on what the respiratory rate does. Running economy shows mixed results. Sometimes they'll go up, sometimes they'll go down, and that's generally due to when you're at high altitude, you're not able to perform exercise at the same intensity. So you have less intensity, so that actually might be able to help your economy a little bit. But like I said, that's mixed results, so it can go either way. So I do want to talk about some negative aspects of altitude training. So these are something to keep an eye on. Warn your athletes, as long as you are aware of them, you should be able to avoid them, but this is something to keep in mind. So you will have a decrease in maximum intensity workload. So when you're at high altitude, you will not be able to perform the high intensity exercises that athletes generally want to perform. And that leads to a decrease in VO2 max because you are not working out in that high intensity. At altitude, fatigue occurs more rapidly, so you're not allowed to perform endurance activities as long either. And at altitude, brain can depress muscle activation as well. So those are the three factors that really work on altitude training, the negative aspects of it. And here's physiological, some negative aspects. Decrease in plasma volume. That decrease in plasma volume will lead to an increase in hematocrit. So really you don't have an increase in red blood cells, you just have an increase in the percentage of red blood cells because there's less plasma in the blood. A decrease in alkaline reserves, and that's mainly due to the hyperventilation. So you're breathing so much that you have to use your reserves to keep your pH neutral. You have the increase in ventilatory response, and we talked about earlier, you can't train as hard or recover as quickly. I also want to talk about altitude-related medical conditions. One of the most common ones is acute mountain sickness. And this is fairly common. It generally takes a day or two, but what happens is they have less oxygen going to the brain, and they feel sick. They feel dizzy. They can get stomach sick, but they basically feel a common cold. Generally, it's not a big issue. It takes a couple days to get acclimated, and they'll be over it. But you do want to keep an eye out for the other two medical emergency conditions, which are high altitude pulmonary edema and high altitude cerebral edema. And basically what's happening here is you have that fluid transition in the body, and that fluid is coming from the blood into the cells, and that transition can leave pooling of fluids in the lungs or in the brain, leading to possible medical emergencies. And this is generally can be prevented with knowledge, and also if you are diagnosed it, if you return to normal elevation, it generally subsides on its own. So here's a little chart. This is all the acute and chronic responses to altitude training. So at this point, if you still have questions on them, I want you to pause the video, check them over. But I talked about most of them already. This is just for your knowledge. Okay. I'm going to go into types of altitude training. So the first one this is the traditional approach, is the live high, train high technique. This is kind of what they saw in the Olympics with the Kenyans and the Ethiopians coming into Mexico and basically dominating. So they lived in the high altitude and they trained in the high altitude, so they had to increase performance in that high altitude. However, generally, live high, train high is not going to be beneficial for sea level performance. So if you are, sea level performance is where most of endurance activity takes place. So that's why this one isn't as desired. If you are training for a possible high altitude performance, then this is the way to go. But it does show mixed benefits for the sea level benefits, and that's mainly due to the lack of high intensity exercises you perform at that high altitude. So the second technique I'm going to talk about is the live high, train low. This is the most popular. This is the one that is generally regarded as the most effective. So you live at high altitude, you sleep at high altitude, you perform all your daily activities there, but maybe 2 to 3 times a week you come down and you perform high intensity exercises. And that's generally, this is, like I said, this is the preferred method. So you get the EPO stimulation from the high altitude, and you also get the high intensity exercises at sea level. The hardest part with this one is it's not always practical. It's hard to find a place to live high and then a place where you can get down low and train at sea level. We'll talk about some alternate methods later on, but that is generally the biggest issue with this one. But research does show that this one does increase red blood cell count and has shown high effects for increasing endurance performance at sea level. And it also says here, researchers showed increased VO2 max, 5K performance, and red blood cell count. So that's generally, if you're working with an elite athlete, that's what they're going to be going for. The third technique I'm going to briefly talk about is the high, low training. So for this one, they're going to live high, and they're going to perform aerobic activities at altitude. but they're going to perform those high intensity exercises at the low elevation at sea level. So they're still getting the high intensity workouts, encouraging the VO2 max, but then yet they also have the EPO stimulation and the increase in red blood cell count at the high levels. So this one has shown very similar results to the live high, train low technique. So a lot of people think that they're kind of interchangeable, but you have to be careful with how much intense workouts you're doing because you want to keep those up. So this led researchers to believe that the huge issue with the live high, train high technique is that they can't perform those high intensity workouts. So altitude training techniques. So negative effects could explain why the following the traditional approach of live high, train high technique isn't always that effective. High low provides the benefits of improved oxygen carrying capacity while allowing the athletes to train at a higher intensity at low elevations and not suffer neural consequences. So practical application. So generally when you are prescribing this, you want altitude should be between 2,000 to 2,500 meters. Generally the sweet spot's regarded as 7,500 feet, so you want to get in there. More than 2,500 meters has no greater EPO response, so you can go higher. It's not going to give you any benefit, and it's just going to be more resistance and more work. So generally you want to get right at that sweet spot, which is 7,500 feet or between 2,000 and 2,500 meters. Time-wise, you want athletes to be exposed for the training purposes for 4 to 6 weeks. So that I have a training slide coming up, but that can not include acclimatization, then 4 to 6 weeks of the altitude training portion, and then maybe a week of weaning off of it and be preparing for competition. Some research has shown that EPO injections doesn't really have effect until the 3rd and 4th week after the injections itself. So that's kind of iffy. Some research has shown that after altitude exposure, you have EPO response 18 hours after altitude exposure. So you see here, this is a designed training protocol for altitude. So you give them a week of acclimatization. Like they might go through that acute mountain sickness. They might not. But you want to prepare them, perform slow endurance activities. And then the training period for this one is 2 to 4 weeks. So you want to have the high intensity exercises, and these want to be performed at your sea level. But you also want to perform your aerobic activities at altitude, depending on which one you're going for. And this has a week of recovery, and then you return to sea level, and then we'll talk about when to use your performance after returning to sea level. So like I said, returning to sea level, for some, altitude exposure kind of has variation of response. Some are respond very well to altitude and have increase, while some aren't responders at all. We call them non-responders, and they can literally be at altitude for 5 weeks and have no EPO stimulation, and they'll just have acute mountain sickness the whole time. But when you return off the sea level, some respond best 1 to 3 days, but generally it's 2 to 3 weeks is your time frame. So you want to schedule your event, or not schedule, but prepare yourself. Give yourself 3 weeks to come down, and then you have 3 weeks to prepare for the endurance event. So generally that's considered the sweet spot, is at 2 to 3 weeks in there. So some techniques, like I said earlier, live high, train low isn't always practical. Maybe you're in a flat region, you don't have access to a hill or a mountain. Some techniques that can be used are going to be basically hypoxic chambers. You'll have altitude tents. All basically use different methods to reduce the oxygen content. This one that I pulled up here, this is what they do here is they pump in nitrogen. So they lower the oxygen content to around 17%. Generally it's at 21%. So you're not breathing as much oxygen, so making it more difficult for your lungs. Hyperventilation will happen then. So that's something where maybe you don't have a mountain or anything by you. This is something that you can attempt. However, the altitude training